The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello, and welcome to Health for a Lifetime. We hope that as a result of your time with us today, you will have health that lasts for a lifetime. And to help us today, we have Dr. Glenn Wilsey. He's from North Dakota, where you've practiced medicine for many years, a wealth of experience, still practicing and still teaching there at the Black Hills Health and Education Center. And with all of this, you know, I read a proverb the other day that said this. It said, beware of old barbers and of young doctors. So you're safe.
I'm safe. I'm neither one.
That's right. Exactly. To introduce our topic today, which is brittle bones, osteoporosis, and protein, how those things all relate. You know, there's a text in the Bible that says, I wish above all things, beloved, that you would prosper and be in health. And I think that's what God wants for our bones, too, don't you?
I think so. In fact, God wants us to be healthy. He wants us to be prosperous. And we know that He wants our souls to prosper. And so if He wants that, just as your soul prospers, so you should be in health, and so you should prosper materially. There's no sin to be rich, even, if you do it honestly and with God's blessing.
All right.
So yes, we need to be healthy, and we can be with God's help if we'll follow the instruction of the man who authored, the individual who authored the instructor's manual.
I bet you there's a lot of people getting rich over osteoporosis today. How big a problem is it?
It is a major problem. There are millions of people actually who are involved with it. Research has shown that there are about 10 million women in America who are afflicted with osteoporosis. It's been calculated by observation and research that from 13 to 18% of the women past the age of menopause are suffering from osteoporosis, so it really is a very common problem. 1 in 2 white women will have a fracture due to osteoporosis sometime during their lifetime. And the costs, astronomical, estimated at about almost $14 billion a year just to take care of the complications from osteoporosis.
I think I have an answer, a $13.8 billion answer. You want to hear it?
I might as well.
Milk.
Milk.
Is that the answer?
I'm afraid, even though you may hear some advertisements that would make you think that milk was the answer to everything, it really is not true when you get to analyzing it. In fact, if you look over the world, the nations where the least milk is drunk also have the lowest incidence of osteoporosis, and the country, like America, where the most milk is consumed, we have the highest incidence of osteoporosis. So there is an inverse relationship between milk consumption and the presence of osteoporosis.
You're not a vegetarian, too, are you?
Well, it could be that I am.
Well, what do you do for protein?
Is protein a problem? Can
Yeah.
protein be a problem?
Yeah.
When people think about vegetarian lifestyle, that's one of the first things they think about. How do you get enough protein? There's a lot of emphasis today on the vegetarian diet, and there is a relationship between the vegetarian diet and it's lower than the standard American diet's amount of protein and osteoporosis.
Okay.
And that's the reason that we tie these two together, osteoporosis and protein. We're going to be talking about those together because there is a definite interrelationship between those two.
Well, what is that relationship?
The relationship is that the more protein a person eats, the more calcium he loses from his body, and if he's losing more calcium, he's going to be losing bone structure as well.
So the osteo means what?
That refers to bone. Osteo tissue are our bone tissue.
Porosis, what does that
Porosis
mean?
means holes in it.
So
we
what's
have bones with holes in them.
And if we could pull out someone's bones, we're not going to do that today, but if we could pull out someone's bones, they'd have a whole bunch of holes in them?
That's right. Actually, if you look at the bone structure in our body, you might think of it as a bridge. And you know, a bridge is built with interconnecting girders that brace it so it's braced in all directions. And our internal structure of our bones are built exactly the same way. There are stress supporting
beams and pillars
of
and
bone,
everything. Okay.
and calcium is the hard substance that makes them strong.
I see.
With osteoporosis, calcium is leached from the bones, eliminated from the body, and the supporting structures, those beams, are weakened. A person is then more vulnerable for fractures, and so fractures occur much more frequently among these people who are osteoporotic.
Is osteoporosis to the bones like termites are to wood?
It would be a very good analogy, yes, that's right. It just weakens the structure. There's just a little bit of connecting structure here and there, but the strength is gone.
Okay, who's at risk for this? I mean, is this just something for someone that's, beyond age 50, or who's at risk for this?
There are a number of factors that make it so that a person is more likely to develop osteoporosis. We might take a look at those and find out just who is at risk. First of all, it's usually women. They usually are fair-skinned, fair-complected, or red-haired. They usually have a small stature. In other words, a woman who weighs 100 pounds, 5'1" or 2", she's a lot more likely to develop than the big woman who's 175 and
is that right?
5'8".
And you would think the opposite. Is that because there's no weight bearing on,
I think there's less weight on the bones, and
okay.
also there's less bone structure there to start with
okay.
as well. Family history is another risk factor. A woman whose mother and grandmother had osteoporosis is also more likely to develop it. Also, a woman who begins menstruating early and who has an early menopause is more likely. And apparently the reason for this is that the woman is exposed for a shorter period of time to the female hormones that do have a protective effect against calcium loss.
Isn't it true that vegetarians menstruate later?
That's right. That's another plus for being a vegetarian.
Okay.
Another thing that makes it more likely to develop is a person or a woman who has never had a baby, or a woman has her first baby later in life. That term, nulliparous, there means no babies.
Okay, nulliparous. That's
right.
my word for today.
That's right.
All right.
Okay. A sedentary lifestyle, you alluded to exercise before. Exercise definitely helps to prevent osteoporosis. The pounding effect, the impact of a person's feet hitting the ground is transmitted up to the bones and stimulates laying down of calcium in the bones. Then the use of tobacco, alcohol, caffeine also make it so that a person is more likely to develop osteoporosis.
Someone told me once that if you drink a cup of coffee a day for a year, you're going to lose, I don't know, they told me something, 1% of your bone mass per year. Were they right?
I think that, I'm not sure the statistics, but that sounds reasonable. It sounds about right, yes.
So if you stop drinking coffee, you'll stop that process.
You'll slow down your bone loss, that's right.
All right.
And also a person who has a low calcium intake or who takes a low intake of vitamin D is more vulnerable to developing osteoporosis as well. And another thing that ties osteoporosis and the protein problem together is that a high-protein diet also fosters the development of osteoporosis.
We need to come back to that high protein thing because I have some questions for you on that. But before we do that, are there any other risk factors?
Yeah, there are some others. Age enters into it. The older a person gets, the more likely he is to have lost enough bones that his bones will be weak. Also, dementia, mental illness. A person is less likely to take good care of himself. A person who's in poor health, who's frail already, is more likely to develop it. A person who is unsteady, maybe has a neurologic disease and has recurrent falls, is more likely, because any fall is more likely to break a bone. And then, of course, a person who has impaired eyesight, not going to be able to see the step that he stumbles over and falls and causes a break.
So wait a minute. Those things actually are related to osteoporosis, or are they, in other words, when a bone is broken, does that pull more calcium stores out or something to repair it?
Actually, the repair of a bone does not deplete calcium from other parts of the body, from other bones in the body, as far as we know. I haven't really read any research on that, but as far as I know, it doesn't interfere with the healing of the osteoporotic bone, although a person who has osteoporosis, if they have a fracture, it'll heal more slowly than the person who has normal bone structure.
I told you I'd come back to this protein thing. What exactly is protein?
Actually, proteins are a combination of what we call amino acids. Now, amino acids are a chemical structure that consisting of combinations of carbon, nitrogen, hydrogen, and in some amino acids actually sulfur.
Mm-hmm.
The body takes these amino acids and combines them in different combinations to form different proteins.
I see.
The protein that's in your skin is different than the protein in your liver, that's different than the protein in your bones, and so forth. We might think of an analogy of the alphabet, the letters of the alphabet, we take and combine them together in different ways to form words.
Okay.
So the body takes different amino acids, combines them together in different ways to form different proteins. So that's the way they're formed. Then these proteins are used by the body as building blocks for our bodies, for our body structure. So you might think of proteins as bricks, and they're the bricks that build up the body building. So that if we have an adequate amount of protein, the body is built up well. And also, the speed with which a person or an individual or an animal matures determines the amount of protein it needs. For instance, a rat that grows from babyhood to adulthood in just a couple of months needs a milk source that's much higher in protein than the human baby does that takes 18, 20 years to mature.
I see.
And that's the reason you can't substitute cow's milk for human milk.
Okay.
It just works differently.
Well, people do that all the time. I want to come back to milk, but you're saying that's not the best. So where do we get these sources of protein? Do we get them from animals? You're suggesting we get them maybe not from animals.
We can get them from animals, but the animal diet, the standard American diet, has too much protein. The average American eats about 95 grams of protein a day, and we actually need only about 45 to 55 grams of protein a day. And if it's an ideal protein, probably even less than that, according to some researchers.
Okay.
So that one of the problems is that our bodies, the bodies of the average American, has to eliminate an excess amount of protein and the waste products from protein metabolism. This throws an extra load upon his kidneys where this elimination process takes place.
Is this a problem with milk?
That's one of the problems with milk as well. Milk, of course, is a protein, has a large amount of protein in it, but the use of milk has other problems as well. We have the infection that is carried by milk. We hear reports frequently about a salmonella infection or a strep infection that's traced back to milk that people were using. So that milk is really not the answer for the osteoporotic problem. It really compounds it.
So when they talk about strong bones and drinking milk and that milk mustache and whatnot, that's not really credible? Is that what you're saying?
The white upper lip makes good advertising copy, but it doesn't make good health advice. A person's better off to get his protein from other sources that are lower in protein and that don't carry the risks that milk has.
How does calcium relate to all this?
Okay, calcium is eliminated from the body along with the elimination of the waste products from the protein metabolism. In other words, our kidneys, where the protein waste products are eliminated, have to be combined with calcium as a calcium salt.
I see.
And so this eliminating an excess protein, the average American eats twice as much as he should,
takes calcium
takes calcium from the bones, and the bones are a major source of supply of calcium in the body.
We've been talking with Dr. Glenn Wilsey. He's a physician in North Dakota, works with the Black Hills Education Center in South Dakota, and he's been talking with us about protein, osteoporosis, calcium. When we come back, we're going to talk a little bit more about this subject. I know a lot of people struggle with it, have problems with it. We hope that you'll join us when we come back. We're going to talk about calcium testing, about osteoporosis testing. Is it credible? Should we do it? We hope that you can join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, They present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. If you've just joined us, we've been talking with Dr. Glenn Wilsey. He's a physician in South Dakota, and he has been involved in health education for many years and also medical practice. We're talking about osteoporosis. We found that it's a large problem, and it has cost not only financially but physically, and we found that the normal solution that we usually hear, these solutions are not really helpful, i.e. milk and some of these other things. Doctor, what about osteoporosis testing? Someone's watching today and says, hey, maybe what I should do is get that test finally and see how bad it is for me. Is that helpful?
It can be if the person is planning on starting on a treatment program. If you're not planning on treating it, if you find a problem, there's really no use doing the testing. Mm-hmm. But if a person is planning on doing something about it, then yes, it's a good idea. Who should be tested? If they're going to follow through with treatment, if it's indicated, postmenopausal women with one or more of the risk factors which we discussed earlier in our program. All women past the age of 65 would be candidates for being tested. Mm-hmm. Postmenopausal women who have had a fracture definitely should be evaluated.
Broken a bone, something like that.
Okay. Right. Women who are considering therapy of any kind, and also women who have been on hormones, estrogen hormones, for any prolonged period of time should be tested from time to time as well. I think we maybe should go to this matter of calcium loss from the body and show a little bit of research that's been done in that regard. There was a graph that we have that shows what happens when a person uses different amounts of protein in their diet.
All right.
There's what we call a calcium balance. And if a person eliminates from his kidneys more calcium than he takes in that day, he's said to be in positive calcium balance. If he eliminates more than he's taken in, then he is in negative calcium balance.
All right.
And this graph here shows, the first graph, on the left of this, the bar shows a positive calcium balance. The horizontal line is 0 point.
Okay.
And these people were fed 45 grams of protein a day. And you notice that they had a positive calcium balance.
Okay.
They took another group of people, fed them what the average American uses, 95 grams of protein a day, and you notice that they have a negative calcium balance.
In other words,
they're losing more than they take in.
All right.
Then just to prove this point or to demonstrate that it really was true, they fed them I believe it's 45 grams of protein a day. And look at the negative calcium balance that these people had.
That just was flowing out of their bodies.
They were just losing it by the gallon. Mm-hmm. So from this we can get the conclusion that we better cut down on the amount of protein that we take into our bodies. It'll help to make it so that we'll be much less likely to develop osteoporosis.
You know, I heard someone once talking about the astronauts and protein problems. Have you heard anything about that?
Yes, I have, and also osteoporosis. Both of those things are problems with them. The condition of weightlessness up there apparently is one of the major factors in that. You know, they're not striking their foot to the pavement time after time or to the floor, and this impact has a positive effect on calcium metabolism. And it may well be that their diet has something to do with it. I haven't heard any research on that, and I don't know how much protein they're taking, but if they're treating them the way the average American treats himself, which is 95 grams of protein a day, then this also can be a factor with them too.
We've talked about some of the, the bad news when it comes to protein, osteoporosis. We've talked about some of the supposed solutions that really aren't solutions. You've suggested several things. We should be vegetarians. We should get our protein from plant sources, and that includes milk. And you've suggested that the milk mustaches are just that, milk mustaches, but they're not really that conducive to bone health.
Right.
What should we do to treat the problem if we have it?
Okay, well, there are things that we can do that'll keep us from getting osteoporosis. Number one, we should get plenty of exercise.
Okay.
And this should be impact exercise. Walking, running, jogging. the exercise that you get when you're just sitting in your rocking chair rocking.
Swimming is no good?
Swimming is not as good as impact. Swimming is good exercise, but for osteoporosis prevention, you actually need something where your feet hit the ground, they hit the pavement.
Okay.
That's more effective. Also, another thing is very important is weight control. People who are overweight tend to have more osteoporosis, and also there's more stress on their bones. You'd think that maybe it would help them because of the more work for the bones to do, but actually it makes it so a person is more likely to fall, more likely to hurt himself, and also it does have an adverse effect. The next thing is an adequate calcium intake. We did talk about milk as being a source of calcium, but actually you get a better supply of calcium from the green vegetables that you eat, from the nuts that you eat, the legumes that you're using, so that a vegetarian diet with the type of foods that are in it are much more conducive to preventing osteoporosis than the use of milk and dairy products and animal products.
So there's more calcium in green leafy vegetables and in some of these other grains and different things than there is in milk.
That's right, and it's more available. It's used by the body more effectively as well.
I see.
So we need to go to the vegetables and the grains and the legumes and use those. Another thing that can be used is hormone replacement therapy for women. The female hormones do have a protective effect as far as the bones are concerned. And it's been found, and numerous studies have corroborated this, that women who are on hormones are less likely to develop osteoporosis than the woman who is not on it.
Can they cause other problems, though, hormones?
This is one of the difficulties. There are some complications that can occur from the use of hormone therapy.
Okay. Such as?
Breast cancer. Women who are on hormones are more likely to develop breast cancer. The risk is not increased a great deal, but it's still there.
I see.
Also, endometrial cancer, cancer of the lining of the uterus, is more common among women who are using hormone replacement therapy.
But weighing those two things, which is... what would you say?
For the most part, most women actually, if they will monitor themselves for the possible early detection of any of these things, they're really better off to use the hormones, except if they follow a good lifestyle, the use of the hormone therapy is not as significant.
I see.
There's another problem, too. Women who are on hormones tend to have breast tenderness. They develop deep vein thrombosis, developing blood clots in the veins, particularly in the legs, and they can sometimes break loose and go up to the lungs and cause death. These hormones affect their mental status. They have mood disturbances. And also women who are on hormone therapy tend to develop gallbladder disease more frequently than women who are not on it.
So are there any studies on the effectiveness, though, hormone replacement therapy?
Yes, there are, and it is effective. It does help. They take a large group of women, put them on hormone replacement therapy, and they find that they are less likely to develop the complications of osteoporosis, which is primarily fractures, than the ones who don't. But if a person will follow a good lifestyle and stay away from the high-protein diet, and I think we need to underscore this, the high-protein, sad American diet is really a major factor in the development of osteoporosis. And following a good lifestyle as far as exercise and diet is concerned is really the best way for a woman to go.
What about vitamin D? Does it have anything to do with osteoporosis?
Yes, it does. Vitamin D is the vitamin that helps the body to lay down calcium in the bones. But not very many of us get a low vitamin D intake. You know, you can be out in the sun, expose your face and hands to the sunshine for 10 minutes a day, and that'll give you all the vitamin D that you need, just that's manufactured by the body from the exposure to the sunlight. So that we don't need to really worry about taking an adequate amount of vitamin D.
What are some of those medications that you mentioned that people could consider, maybe they could mention to their physician or something?
Yes, there are medications that have been used for the treatment of osteoporosis. They're effective. They certainly can be used. We could go over the medical terms. Fosamax is a trade name for one of them. Miacalcin is another one. This is the new form that's come out in a spray that can be sprayed into the nose, and it's absorbed through the nose and has its positive effect on the bones. And women who have used this in studies have actually had a 40% decrease in the number of fractures that they've had.
Is it expensive? Do they pay through the nose?
And they pay through the nose for it too. Yes, it's very expensive. Yes, I don't know exactly, but it's probably I would guess in the neighborhood of $7,500 a month.
Is that right?
So that's
now let me ask about these medications. And once you've lost the calcium from your bones and you're past age 50 or whatever that cutoff point is, or, you know, I guess you store it in your bones till maybe up to 30 or something. Can you ever get it back once you've lost it? Or is this just making sure you don't lose more?
It's primarily a matter of prevention, keeping yourself from losing more calcium.
I see.
We can build back a little bit. It does tend to build back a little with proper lifestyle and proper therapy. But for the most part, a woman, once she has osteoporosis, she has it for the rest of her life. There also is a hormone that's related to the estrogens, which has been developed recently by one of the drug companies, which also has been shown to decrease the fracture rate. And it seems to have very few side effects.
What's the name of that?
The name of that is Evista.
Okay.
Evista is the name of it, or the generic term is Ralifin. Ralifin or Evista.
Evista or Ralifin. So if you're watching and you want to know you know, the names to say to your physician, these are some names to jot down.
Yeah. But the most important thing is that change in the lifestyle.
Change in the lifestyle, the exercise, the weight-bearing exercise, all those different things, avoiding caffeine, avoiding nicotine, all these other things.
And reducing the amount of protein in the diet.
Especially protein.
About half of what the average American uses.
You know, we were talking about this subject, and you told me a cute story maybe you want to share with the viewers in our last 2 minutes here.
I think it's important that we make provisions ahead of time rather than waiting until we get the serious condition and then do something about it. Prevention is a whole lot better than cure. And I like the story about a monastery that was built high on a cliff. And the only access that visitors had to there was a basket that the monks would lower over the wall. The visitor would get in the basket, and then they would haul him up. One visitor was there one day, and he noticed that the rope was getting rather frayed. And he got to the top safely, and he said to the monk when he got up there, he says, "How do you fellas know when it's time to change the rope?" And he says, "Whenever it breaks."
Ooh, not
if
good.
we wait until our bones break, if we wait till we have a heart attack, if we wait till we have cancer, sure, something can probably be done, but the risk is really there. So the best thing is prevention. Make provision ahead of time for replacing that rope rather than waiting until it gets frayed and breaks.
So don't wait till it happens, act now.
That's right. I like another example also. Moses, when he was getting ready to deliver the children of Israel, he saw this Egyptian beating the Israelite. As the Bible says, he looked this way and that, and seeing no man, he did it. If you have to look this way and that before you do something, you probably better not do it.
That's good advice. We've been talking with Dr. Glenn Wilsey. Don't wait until that rope frays and breaks. You've heard some good information today. We've talked about osteoporosis. It's a huge problem. $13.4 billion a year are used in the treatment of this. You've had some good advice about what to do, some very practical things. We hope that you put this advice to good use, and that as a result, you have health that lasts for a lifetime.